Hello, everyone. I am Melissa Fogner, the Director of Solution Enablement here at Infinx. Welcome again to another session of our office hours. Today, we have the esteemed pleasure to have Randy Boner with us today. He is our Senior Client Success Manager and has a wealth of knowledge when it comes to prior authorizations and everything in the roadblock area of these prior authorizations. Randy, say hello.
Thanks for the introduction, Melissa. Happy to be here and be a part of another office hours.
Great. So today, as we said, our topic is going to really specialize in prior authorization and the details that goes along with it and some of the pain points that we all experience in working these in the industry. So Randy, let's kind of start off with, I'm sure we all already know and are very familiar with prior authorization and why it's required, but can you give us your point of view of everything?
Well, I think in short, a prior authorization is a headache. But yeah, I mean, a prior authorization is really just a requirement by health plans to obtain approval of a procedure or medication before the care is provided. And providers should always check for and obtain prior authorizations when they are required before performing services to ensure that the company will pay. Really what it is insurance companies use prior authorizations to make sure that the procedures being requested by the providers are actually medically necessary.
Mm-hmm. Yeah, I know for me as a patient, as all of us are patients, not only do we deal with it on the healthcare side, being in the industry, but as a patient, it really impacts our care and everything that we need to do to make ourselves feel better. We don't want to be sick. So going through some of these things and waiting on care because of prior authorizations that the normal individual may not know about. So it's definitely a pain point for providers, for patients, and in the industry. So on top of that, what are some of the main concerns that providers have regarding the administrative burden imposed by the payers for prior authorizations?
Well, really, I mean, prior authorizations are very time consuming, and it really takes a dedicated team to stay on top of initiation, follow-ups, and all the different payer updates. And without an efficient process in place with experts, providers really run the risk of delayed patient care and then denied patient care as well. With not having an efficient prior authorization process in place. And really what's at risk here is patient experience. I find that patient experience with the providers that I work with tends to be a lot worse when the front office is actually also tasked with running the prior auth process, just because of how complex it is, how much time it takes. So obviously, if you have a team in the front of your office that's taking care of prior authorizations, your patient experience will really lack. Because you really want, interaction with your patients. You want to get that next schedule on the book, stuff like that. So yeah, patient experience is always at the risk of, prior authorizations.
Yeah, and for those that are patients, we don't understand what the complexity is. All we know is we need to have treatment and, when can we get that scheduled? And whether it's pharmacy, surgery, certain injections, there's a lot of things that go along with it for patient care. How does it really interact, in your opinion, the relationship between providers and payers, whether it goes into terms of denials or delays of care?
Yeah, I've definitely seen, the prior auth process create tension between providers and payers. This is because some payers tend to be inconsistent, whether it be inconsistencies with the requirements for an authorization. Maybe now they need a certain thing added to the clinical notes, or even it could be inconsistencies with turnaround time. If we're expecting a turnaround time of 2 days for this prior authorization, but now the payer has a new process in place or new requirements in place that take longer, and now that turnaround time is maybe 5 to 6 days. Well, if I know that if I'm expecting turnaround time to be 2 days, I'm going to schedule the patient accordingly. So whenever the payer has these inconsistencies with requirements and turnaround times, patients have to get rescheduled or they miss their care. So really that's what it all comes down to. And that's why there is tension, because the scheduling process, getting patients in the door, that all is reliant on the prior auth process.
Yeah, you're right. And you mentioned some things about inconsistency and the complexity with this process. What are some of those things set by the payer that the providers and the teams are dealing with when it comes to this inconsistent, complex process?
Definitely. So, each provider, each, healthcare system, they know their payer mix, or at least they should. So they should have some tribal knowledge of, we know that this payer requires authorization. We know that this one doesn't. We know that this one requires authorization. We need to submit for these things. So knowing what the payer requires for an approval is very important. And with that knowledge, providers can work with their physicians to get stronger clinical notes that actually cater to those payers' requirements. And then on top of that, if you're calling on these payers, because not all of them have portals, speaking with an insurance rep is a great way to get inconsistent information. You don't know if the insurance rep's giving you the right information, wrong information, because they can give you wrong information and you'll still get a denial. So like, for example, a rep can tell you that authorization isn't required for this procedure. Then you go ahead and, provide the services, and then you receive a back-end denial for not having an auth on file. So again, these inconsistencies from the payer ultimately result in delayed patient care and write-offs, which create tensions between the payers and the providers.
Yeah, I know of a case specifically where a patient had been receiving certain injections and migraine treatment for, over a year, and it was getting paid, and the process was very expensive. In the next calendar year, same plan and everything, it was denied due to not having FDA approval. So it's this inconsistency of that wrong denial reason that really, put that burden on the patient having to make that out-of-pocket payment when they expected the insurance to pay for it, because it was originally prior auth. So that back-end denial was really a change for those patients.
Definitely.
Yeah. So I do want to mention that we do have our open Q&A. If you all have any questions, feel free to go into the chat or into our Q&A session, and we'll be happy to bring those up on the call. So as far as the next piece, how does a prior authorization impact the patient care with the treatment delays, increased health costs, and patient dissatisfaction with those items? What can be kind of in this process? How can technology really help this process go smoother?
Yeah, for sure. Let's start with treatment delays. So prior authorization requirements, they can result in delays in patients receiving, necessary treatments that lead to potential negative health outcomes. The prior authorization process also discourages walk-ins and stat services due to the time that it takes. So that's another thing to take in consideration. If you're a business and your model is to accept everybody, you want everyone to walk in and, get their services. Well, now if your top payers require authorization for those same services, that's going to take time. So you're either going to have angry patients in your waiting room for a while, or you're going to have to schedule them out. So something to definitely, take into consideration. There's also going to be some increased costs. So there's an admin burden associated with prior authorizations, and providers need to allocate resources efficiently to manage this process. And like I said, you need a dedicated team. It can't be, a team side project to do authorizations. You need an actual dedicated team of experts to make sure the prior auth process runs smoothly. And of course, that costs money. You're not going to go the cheap route and have an efficient prior auth process. And really what's at risk again is the patient dissatisfaction. So, patients can become frustrated with the healthcare system if they receive delays and denials associated with prior authorizations, because like you said, Melissa, patients don't know what prior authorizations are. They don't understand what that means. So whenever you delay a patient's care, they think it's you doing that. But I mean, obviously it's the insurance company, but they don't understand that. So patients get dissatisfied. And then even if you provide services without getting a prior authorization, and then the patient gets some surprising news down the road that because they couldn't get prior authorization approval, now they need to self-pay for the procedure, and that's never good news to give anybody. So, those three reasons alone, kind of generalized everything, but that's how it impacts patient care.
Yeah, absolutely. And there's a lot of technology that's out there. Again, it's only as good as what we're able to do with the payer. But I think that really kind of goes into looking at how the authorization requirements impact revenue and medical practices, and bringing that negative piece for prior authorization in a practice and losing revenue, but how, using some of our technology ideas and things that we can help streamline that process. But let's first talk about the impact of revenue in the medical practices. I know in the past few questions, we've really honed in on that, but I want to kind of bring that up just to hone in directly on impact of revenue.
Yeah, definitely. And I think to talk about revenue, we should also talk about cost. So on the front end, medical practices will have to incur some type of cost to get a prior auth process in place. That could be an in-house team, or that could be an outsourced vendor. When you use an outsourced vendor like Infinix, not only do we have a team of experts, but we have AI machine learning that really make the prior auth process efficient. And it really reduces any quality issues that you have with that prior auth process, because quality issues do result in back-end denials and will impact your revenue. So, these can include incorrect authorization checks, providing patient care outside of approved authorization due to, lack of authorization tracking, getting approvals for the wrong procedure codes, stuff like that can all result in denials, which will impact obviously your bottom line. But having that prior auth process in place and making sure it's efficient will make sure you have a healthy revenue cycle, and it starts from the beginning of the patient access and from the beginning to the end. So you need to have that in the front end. So while organizations do need to make the decision to spend money up front on prior authorizations, it's absolutely necessary to ensure a healthy revenue cycle.
Absolutely. So what are some things that practices and health systems can implement to mitigate the revenue impact of prior authorizations? We talked a little bit about the Infinx solution that has our, revenue cycle management from eligibility, prior authorization, and really works within that platform for those two things. But what are some additional items that we can do from Infinix or another vendor that can help out?
Yeah, there's absolutely strategies that, organizations should put into place. The first one I'd recommend is partnering with, a company like Infinix, because we focus on this, right? So every day we wake up, we do authorizations. We have technology in place that initiates, that is in control of follow-ups. We'll give you the right information. We could, hook up to your EHR through APIs or HL7s and make it very efficient and streamline the process as much as possible. Obviously, the process is inefficient because you're dealing with payers, but we make it as efficient as that it possibly could be. But outside of that, if organizations know their payer mix, have that tribal knowledge of their payer mix, they should know which payers require authorization for which procedures, and this will help, expedite the process. So, because that, okay, this patient wants to come in for this procedure, they have this, health plan, we know that requires an auth, we should schedule them this far out because we know we need to get off. Stuff like that would definitely make your, your process more efficient. Each payer has different ways to request authorizations. That could be calling, faxing, or using a web portal. I would highly recommend, getting access to all your payers' web portals when applicable, because it's the most efficient way to get accurate information. You can track your authorizations, and if you need to dispute a denial in the back end, you can use screenshots or use the records from the web portal that will help you with that. So each way of initiation has its own set of requirements, whether that could be faxing in certain forms, attaching different clinicals. Those are all things that you should be aware of whenever you're working with your payers. So yeah, understanding the payer mix is very important for providers.
Absolutely. And payers change their policies on a frequent basis. So it's also keeping up with all of that information that may or may not be listed on a portal. So having that technology and something like Infinix is able to keep up, and the connections that we do have with them, but it puts it right in front of us. Back when I was doing prior authorizations, I had the binder, I had my Post-it notes everywhere. I was hand filling everything out and walking over to the fax machine. And I know we still have to do that in certain situations today, but having a platform like ours, I think really helps define and sets the stage of what I need to work on first for stats, urgents, or something that's next week. And it gives me a full view of the workflow for myself, for my team, and the entire organization. So,
Definitely.
Oh, sorry, go ahead.
Yeah, no, definitely. And just to piggyback off of that, a big problem I see with, in-house teams that are in charge of the prior auth process, like you said, hand filling or even hand typing in information, that leads to human error. So even just like typos or, putting a secondary when it should be a primary can lead to coordination of benefit denial, stuff like that. Just linking up with a partner like Infinix and being integrated, it makes sure that the right information, the accurate information gets submitted every single time. So that alone will cut off a lot of inefficiencies that you see with this human error. Just due to the nature of the API integration, we know that we're getting the right information every time, right? So that's a big part of it as well.
Now you mentioned about some data entry, and nobody has dyslexia, nobody has that disease. So when you do the right typing or the wrong typing, what are some things out in technology today that can help reduce some of that missed data entry? Bots, assistance, automation. Where does that some of that play within the technology?
Yeah, no, it plays a huge part of it. Because Infinix, just speaking from Infinix point of view, we're connected with the payers. We have connections to the payer portals and all this good stuff. So when we receive a request from a client with, let's just call it a member ID that's ABC123, when we go to verify that information with the payer on their portals, and we find that the member ID is actually ABC1234, we have a process in place that will notify the client, hey, you need to update your member ID in your system because it's wrong. So that alone will fix the backend denials from any type of incorrect information that you might be submitting. Also with that comes the kind of quickness of it, right? So when you're integrated with a company like Infinix, you don't need to type in all your requests on the portals. Everything gets sent over automatically, including attachments. So all your clinicals and notes, those get sent over to us automatically. We'll initiate with the payers in the portals. And not only will initiate, we'll follow up. So you don't have to keep track of your follow-ups. Like, oh, this is a turnaround time of, 10 days. I should follow up every third day. That's a lot to keep track of when you're dealing with different payers. So that's something that our system automatically takes care of. So yeah, it's really important to partner with the right technology in this too.
Absolutely. And the beautiful part of our solution is we have all of that technology, but we also have the team approach to come in to where automation can't be done in those scenarios. So our team is well knowledge of the process and can pick up the phone or can go through the chart to help look for some of those missing clinical documentation that now the payer's asking for. So it's really a good blend of an end-to-end solution when you look at the Patient Access Plus platform that we have.
Absolutely. And, no matter who you're working with, you're obviously the medical, the healthcare system is going to have their top commercial payers, UHC, Cigna, Aetna, all those are fine and dandy and are pretty easy to work with. But every one of those organizations also works with small local payers that probably don't even have portals in some instances. So it's impossible to automate everything, especially when you're dealing with like regional payers and stuff like that. So that's where our team of specialists comes in. We could pick up the phone, we could fax. So it is a full end-to-end solution, like you said.
Right. So when we talk about some of this process of investing in managing prior authorizations and the overall profitability of for practices, how does that play a factor when you bring in the right technology and the right team?
Yeah. So organizations need to make a decision. I would say it really, in general, comes down to two decisions. Do we want to have an in-house team work on this, or do we want to outsource to a vendor? When you outsource to a vendor like Infinix, we create efficiencies within the prior auth process, whereas an in-house team might have inefficiencies within their process just because it's an in-house team. They don't do this on a daily basis. It might not be their specialty, but it is our specialty. So we create efficiencies in the process using AI, machine learning, and our team of experts. And the healthcare practices that we work with, they see drastic reductions in prior authorization related denials. And on top of that, staffing seems to be a huge issue in healthcare today. So specifically looking at prior authorizations, it's really hard to find skilled workers, who have done this before, who have that tribal knowledge. They're just not out there in large amounts of quantities, and especially for the money that you want to spend, right? So partnering with Infinix provides a scalable, efficient solution that I would say is required for a healthcare. That I would say is required for a healthy revenue cycle. And scaling is another big thing as well, too, right? Because if you have an in-house team that's dealing with the current capacity, maybe the organization wants to expand. Maybe they want to buy somebody else. Maybe they want to open up new facilities, whatever it might be. That just means they have to make their in-house team bigger and bigger. And now that in-house team needs to deal with different payer mixes for each different facility. Whereas our solution, our product, can scale very easily with organizations who are looking to grow.
Yeah. And very quickly. I know that we are able to implement very fast and bring on new organizations. So, and even not necessarily in medical, but dental, pharmaceutical, hospital system. So our solution really has that full range of being able to service all specialties as well. So any last words in addition to what we've already talked about today?
Yeah, I mean, I would just say, I know we're talking about prior authorizations, but insurance verification benefits is another big part of this whole process, and you can't have one without the other. And that's another thing to take into consideration, because it's not just prior authorizations. It's every single patient that comes through your door needs to be touched, whether that be, checking the insurance, making sure they're eligible. Is an authorization required? Is there a referral required? What are their benefits? What are different levels of benefits? It's a lot of work. So if you want an in-house team to do that, make sure they're trained, make sure they have the expertise and they know what they're doing. Partnering with partnering with Infinix, really does alleviate all of your admin burden from that process. And it puts it in the hands of some experts that will definitely reduce your denials and get you more money.
Absolutely. And that is a great point. Because even looking at walking in the door, scheduling the appointment, verifying insurance, not having the right information. And if you don't verify the proper active coverage, you could start working a prior authorization on the wrong plan, and you're going to end up in a denial, and because patient's not covered. So you want to make sure that you've got the right eligibility from the start, and to be able to move forward faster on that prior authorization for any of the services as well, because it's just going to delay patient care time and end in a potential denial. So
Absolutely.
Great. Thank you, Randy, very much for all your time and knowledge today. We greatly appreciate it. I know we will see you soon. For the rest of you, thank you so much for joining today. If you'd like to get more information, please go to infinx.com. We are happy to give you more information about all of our products, and looking forward to see you on the next office hours. Thanks, everybody.
Thank y'all.